thank you for joining us today for our COVID-19 health update with Hunterdon Healthcare. As of Sunday at 10:30 a.m. on April 5th, we have 99 patients in the hospital. 28 of those patients have been diagnosed with COVID-19. 21 patients are waiting for COVID-19 test results. 7 patients are in our emergency department currently. 0 patients in the emergency department have been diagnosed with COVID-19, and 6 of those patients are being ruled out or in for COVID-19. So as you have heard the results over the past few days in New York and northern New Jersey, it can be daunting for all of us. But we just wanted you all to know that Hunterdon Healthcare is ready to expand capacity to whatever levels are needed to keep our community safe and healthy. As an example, normally we operate just shy of 180 beds here at Hunterdon, and we are totally prepared to bring that up to 260 beds. And that would be from all the way at the top of the care with the critical care ventilated, more than quadrupling numbers that we normally would be able to do, all the way through all of your care needs. So in order to provide that care safely, it's not just about opening beds, but I want to assure you our entire physician community is coming together in unprecedented ways to make sure that they're providing team-based care, as well as our nursing staff coming together, figuring out who pushes up into different pieces so that we can provide whatever care is necessary. Along with that, our respiratory assessment tent had opened on Friday morning, and we've been seeing about 27 to 30 patients per day in there with varying results on the testing. As we suspected, a couple of those patients would be furthered on to the ED each day, as well as some were tested, and others were spoken to and given medical advice to be able to go home and treat what they had. So again, respiratory assessment tent is open. All you need to do is come onto the campus. It's very obvious. There's a checkpoint. Someone will talk to you, determine whether you go straight to the ED or around to the respiratory assessment tent. And then when you get there, again, you can't miss it. The seamless registration, you stay in your car so that you're not waiting in line or anything like that. We have not really had lines too badly. And then we will call you when it's your time to come to the tent, et cetera. So that's moving really well, and again, feel free. We also have our nurses working the nurse triage line. The phone number will be provided in this video for that, and we invite you to call that if you have any COVID concerns whatsoever, and they will be willing to talk things through with you, as well as all of our physicians in Hunterdon Health System are able to provide visits via telemedicine care. So again, really being at home through this crisis, we will enable you to get a lot of the care without even leaving your home. And if you leave, the tent is freestanding, et cetera, without even coming into the hospital. So that's moving well, and we expect that to be able to handle many more patients than even are there if we come to that eventuality. With that said, I also want to thank you, all of our providers here at the health system and their employees, for their dedication, extraordinary efforts that they've been putting forth and that have been in place really since the pandemic started. And we all realize that it may become a little more difficult over the coming weeks, and we are all gearing up for that. So on behalf of Hunterdon Healthcare, thank you to our community for their tremendous support through this time frame and support of all of our staff, physicians, and employees. Please also help us by doing the things that we all know we should do: staying at home, washing your hands often, covering coughs and sneezes, avoid touching your eyes, nose, and mouth, and social distance when you're with others. We are holding the pen to this story. We can all be the hero if we do our part and flatten the curve. That's really the goal here, is just to flatten the curve at this point And we think that so far Hunterdon County has done a great job at that, and we're hoping to be able to continue that through these difficult days to come. So thank you for joining us for this update. We appreciate it, and again, the best of health to you and your families through these trying times.